everyone. So today our topic is approach to a gynecological patient. We're going to start from the history. In the history, we are going to ask the name of the patient, the age of the patient, why the age, as certain diseases are confined to a certain age. Number three, we have education in order to effectively communicate with the patient. Number four, occupation. Number five, marital status, if married, for how long. Number six, residence. Number seven, date of admission. And number eight, the mode of admission. Now moving on to the next part, which are the presenting complaints. The common complaints encountered in a gynecological patient are: number one, abnormal menstruation. You have to ask about the pattern, whether it is regular or irregular, the amount of blood loss, passage of clots, duration of menstruation, intermenstrual bleeding. It is the bleeding which occurs during in between the menses. And then we have postcoital bleeding, which occurs after coitus. And number two, we have bleeding in early pregnancy. This is usually an indication of miscarriage if it occurs before 24 weeks of gestation. Number three, something coming out of the vagina. It can be an indication of pelvic prolapse. Number four, any pelvic mass. Number five, vagina discharge. If so, the amount, the color, whether it is white, yellow, or any other color, the odor, whether it is fishy, presence of blood in relation to periods, etc. Then we have six, pelvic pain, the site, nature, relation to periods, anything that aggravates or relieves that pain. Now moving on, we will ask about the history of presenting illness. Depending upon the presenting complaint, the following questions can be asked. Number one, the onset. Number two, duration. Number three, intensity and severity of that condition. Number four, the aggravating or relieving factors of that condition. Number five, the associated factors like fever or any other condition, etc. Then we have menstrual history. And in menstrual history, we'll ask about the age of menarche. It is basically the age in which the menses have started. We will ask about the cycle, whether it is regular or irregular. Number three, ask about the duration of the cycle. Number four, quantity of blood loss. Number five, dysmenorrhea. It is pain during the menses. Number six, any intermenstrual bleeding. Number seven, any postcoital bleeding. And number eight, LMP, which is the last menstrual period. Now we will ask about the past gynecological history, which has any previous gynecological problems, for example, an infection or any prolapse, any treatment which was taken for that condition, any cervical swabs taken during that period. Then we will move on to the past obstetrical history, which has number of children, the ages of those children, mode of deliveries of those children, whether they were delivered via C-section or via SVD, which is spontaneous vaginal delivery. Then we have number four, gestational age of all the children at the time of delivery, whether they were delivered at term or they were preterm babies, and also about the state of health of those babies at that time, whether they were admitted in an ICU or not. Number five, number of miscarriages and the duration of gestation of those miscarriages. Number six, the termination of pregnancies, and if they were terminated, at what gestation and what was the reason for their termination. Then we will ask about the sexual and contraceptive history, in which we have age at first intercourse. Number two, the coital frequency. Number three is dyspareunia, which is painful intercourse. Moving on, we will ask about the coital difficulty, number of sexual partners of the patient's partner or husband, use of contraception, and the type of contraception which is being used. Moving on, we will take the past medical history of the patient, in which we will ask whether the patient has any history of TBs, diabetes, etc. Past surgical history, we will ask whether the patient has had any surgical procedure done in the previous time. Then we have systemic inquiry. We will ask some questions about the CVS, CNS, GIT systems, etc. You can ask whether the patient has any palpitations, any headaches, any GIT disorders like constipation, diarrhea, or any other condition, etc. Moving on, we will ask about the family history, about infectious diseases, about any ischemic heart disease, hypertension, diabetes, any history of multiple pregnancies in the family, any gynecological or other malignancies that we should know about. Then we have social, socioeconomic, or biosocial history. We'll ask about the place of living, type of family, the monthly income. Then ask about the drug history, whether the patient is taking any medications for any condition, and the treatment history so far. And moving on to the examination part. For examination, you will start from the GPE, which is a general physical examination, then move on to the systemic examination. The systemic examination will include examination of the abdomen, CNS, CVS, the respiratory system, and the pelvic examination. These examinations are the same which are done in medicine. Okay, so for pelvic examination, it is not really expected from final year students to do pelvic examination, but you must know about the steps. So for the steps, first of all, we have inspection. You will inspect about the hair distribution, labial appearance, any episiotomy scars given previously, stress incontinence, the vaginal discharge. Moving on, you will do speculum examination. You will do inspection of the vaginal walls, whether they are atrophic, healthy, hyperemic, if there is any growth, ulcers, or polyps on them or not. Then appearance of the cervix, and number C, any vaginal discharge. So for bimanual examination or palpation, you will look for the following things. Number one, the consistency of cervix. Number two, cervical os. Number three, uterine consistency, the size, shape, and the mobility. Number four, uterus is retroverted or anteverted. Number five, adnexal mass. Number six, adnexal tenderness. And number seven is the pouch of Douglas. Now, based on the history and examination that you have done, you will come up with a provisional diagnosis, 2 to 3 differential diagnoses. You should know about the investigations, the routine investigations which are to be carried out, and some specific conditions which are related to that specific condition. And you should also know about the plan of management of that certain condition.